Supervisors have the responsibility to attend training classes in order to be certified to conduct reasonable suspicion substance abuse testing on their employees. According to 49 CFR Part 40, 382, 603, the training sessions require that each employer shall ensure that all persons designated to supervise drivers receive at least 60 minutes of training on alcohol misuse and receive at least an additional 60 minutes of training on controlled substance use. Reasonable suspicion requirements can be found in 49 CFR Part 40. The training helps supervisors be able to know physical, behavioral, speech, and performance indicators of both drug and alcohol abuse. These training sessions are important because they need to ensure that their employers are safe as well as the public. Marijuana is a commonly used drug. It is common to see use in a workplace as well as being shared amongst employees. It can also have many effects on the brain, such as having changes in appetite and level of cognitive functioning. Things that could cause reasonable suspicion include the following: physical indicators: reddened eyes, odor on clothing, consistent cough or sore throat. Behavior indicators: confusion, anxiety, aggressiveness, paranoia. Speech indicators: slowed speech. Performance indicators: lack of concentration, not being able to make appropriate decisions, or inability to make decisions in a timely manner. Lack of ability to do tasks normally assigned to them. Cocaine can severely impact an employee's work performance, and consumption or possession of it is a serious federal offense. Some effects that it can have on the brain include increasing the risk of strokes as well as reduced attention to the work they have to do. Supervisors should look for the following things: physical indicators: runny, irritated nose, dilated pupils, visual impairment, restless, sweating, dry mouth. Behavior indicators: paranoia, unable to concentrate, hallucinations, mood swings. Speech indicators: overly talkative. Performance indicators: missing work, withdrawal from activities, unable to pay attention to things that need to be done at work. Amphetamines include meth and speed. These illegal substances are considered stimulants. They speed up the mind and body and are commonly seen for the use of reducing weight and to improve moods. There are many things that the supervisor should look for. These include physical indicators: dilated pupils, excessive sweating, rapid breathing, restlessness. Behavior indicators: confusion, panic, non-alertiveness, fatigue, and depression. Speech indicators: talkative. Performance indicator: false sense of alertness, making it a danger to operate a vehicle. Overbearing fatigue that causes danger in operating a vehicle. Hallucinogens do exactly what they say. They make users hallucinate things that aren't actually there, making it impossible for them to be able to do appropriately their job due to impaired judgment. Unlike some of the other drugs that are discussed, they are not addictive but severely impair the user's sense of reality. Signs that supervisors should look for include physical indicators: dilated pupils, rigid muscles, jerky eye movements known as nystagmus, excessive sweating, dizziness, and loss of balance. Behavior indicators: agitation, confusion, extreme mood changes, or hallucinations. Speed indicators: diminished ability to speak. Performance indicators: severe disorientation, making it impossible to operate equipment safely. Heroin is considered a depressant and normally slows down the user's cognitive productivity. It is a highly addictive drug, and when someone is withdrawing from these drugs, the symptoms are very severe. Supervisors should look for physical indicators such as dilated pupils, tiredness, nausea, vomiting, and constipation. Behavior indicators such as mood changes, fatigue, and drowsiness. Depressant effects. Speech indicators such as slurred speech. Performance indicators such as one not showing up for work because of his "I don't care" attitude, or impairment of physical and mental functioning in the workplace. Alcohol is commonly consumed amongst a lot of workers. However, when a person is addicted and drinks so frequently, it can cause many effects. The supervisor should look for physical indicators such as smell of alcohol on them, staggering, gait, a lack of coordination. Behavior indicators such as being easily agitated, confusion, fatigued, may show signs of depression. Speech indicators: slurred speech, being overly loud. Or performance indicators: difficulty with mental processes, not making appropriate decisions. All of these substances have signs that supervisors should look for before sending an employee for a reasonable suspicion drug or alcohol screening. If any of these signs are present in an employee, the supervisor has reason to send an employee for the screening.